Hello and welcome to Note to File, a clinical research podcast.
A collection of interviews, candid commentary, and general nonsense for the clinical research community.
Check us out at notetofilepodcast.com.
And now, without further ado, on to the show.
Hey dudes, more clinical research stuff. How's it going? Yeah, that.
On Tuesday, May 26th.
May 26th. And we're officially international right now since
We are.
we have Denmark, Denali.
Mm-hmm. I have spent the last 25 hours making my way to Copenhagen, Denmark. So officially here. I made it.
Good. So Veeva can slowly take over the world.
We technically already are a global company, so
Colonizers.
a little bit different.
No, is that not right? Is that not a good way
I
to say it?
don't think that's quite the word that we're using for that.
Fair. Well, you're doing your EU Summit.
Yeah, our EU Summit.
What does that consist of?
So, I mean, it's very similar to the North America Summit, but it's a collection of sponsors, CROs, and this is our first year meaningfully including sites in the summit. So sessions, content, Veeva customers presenting, folks in the industry presenting, Veeva sharing what's sort of on the roadmap. And kind of like a mix between sort of like a user group conference where we talk about sort of what's coming up, what's next, and then customers also present stories. And then specifically for sites, it's the site zone day. So we're doing a day 0, which is tomorrow, is day 0, and then day 1 and 2 are later this week. But for sites, it's specifically bringing sites and sponsors together to start partnering for progress. So really like, how do we better work together for sites and sponsors? So about 30, 40 folks in sort of a workshop, networking, story sharing session tomorrow. And then I'm sure there'll be updates as well. Again, similar to the North America Summit, well, smaller for sure, just based on
yeah. Well, even sites were kind of still a newer thing with your North American Summit, yeah. Yeah,
like last year was the first year we had like a specific site zone or site track, which we'll be doing again this year.
Site zone. Welcome to the site zone.
We'll have you do recorded voiceovers for our marketing material.
I should really be emceeing all events.
I mean, we'll get that. Get your resume updated.
Reach out to my talent agent, guys.
your speaker coordinator. Yeah, so I'll be here. Obviously, we're growing the sites team at Veeva in the EU. It's newer, only a few folks, so we're sort of augmenting from our North America team. So,
I'll say from your, this is probably still limited experience, but like our sites, is the site landscape different, like significantly different in Europe than it is in the US, or like what does that look like? It's something I don't have necessarily a good grip on. So, I mean, I think there's, again, so new also for us. Yeah,
we haven't done a ton of work, and like seriously, there are other folks, on the site solutions team who are going to focus more so on the markets, and who are like doing the boots on the ground work to due diligence on figuring what that is and figuring out what sort of that looks like. I think there's some similarities, right? You're still having hospitals, major medical centers who are doing research, and you also have independent sites. So you're still having like different breadth of sites. I think the biggest variations I've seen are one, obviously healthcare is significantly different.
Yeah, that's fair.
And so how research sits in that and the place it occupies and prioritizes and like it's just a different landscape to operate under.
Well, and presumably, and from what I've understood, I mean, like the US is sort of a little bit more maybe monolithic because it's operating under one set of legislation and rules, where every European country, which is different, right? Like they all have different law rules. I mean, aren't there some places that like don't even allow electronic consent, like in some countries? Like there's things like that,
yeah. And I think that was you can say the other big piece, like the healthcare landscape. Basically anywhere but the US that's a first world country is different, right? generally don't do privatized healthcare like we do.
Better,
So research,
probably better. Am I going?
womp womp.
Discussion for a different podcast.
Different topic. But then, yeah, because it's Europe, which is a continent, not a country. And so you're having different laws, regulations, cultures, customs, all types of things that sort of play into that as well. And so I think there with that. I think also size-wise, it's just not as big. Just the volume of research being done in the EU is not as big, so it's just a smaller market space.
Yeah, I was curious, like, and again, we may not know, but like, obviously we've seen this sort of big M&A and site networks sort of cropping up, growing. Like, is that a thing over there as much as it is here?
It's interesting. We have a guy who's going to be speaking at our Site Zone tomorrow, Jack Evans, who I think is just spinning up site networks, and some of the U.S. site networks are over in the EU.
Yeah, I know there's a couple that are over there. Yeah.
But I honestly don't know. Maybe I'll learn more. Maybe I'll talk to Jack and see if he wants to come on and talk about site networks in the EU. I think that'd be an interesting perspective.
All right, Jackie, come on.
Well, I'll meet him tomorrow and I'll ask.
Perfect.
But it'll be interesting. I mean, I'm excited to sort of hear some of the variations and where that comes up. But those are the big things I've kind of clocked. But again, I'm by far not an expert.
Well, you're on your way to being one.
I'm here.
What are you most excited about, like, for the?
Honestly, it's the same thing I like about the North America Summit. I really think it's important to get sites and sponsors together. I think it's a big issue and it's a big gap. And I don't think there are a lot of forums that do that without ulterior motive.
Yeah.
And yes, it's a Veeva conference, right?
Sure.
We are a public benefit corporation, but we're not a nonprofit. Like, we are a for-profit corporation, right? So there is
there's some benefit there potentially,
right?
For you guys, but nonetheless.
But how we have designed this has really been to like focus on industry challenges, why it's important to bring sites and sponsors together, and like we're able to do that from a, I don't know, less commercially like.
Yeah, I mean, there were sites at Summit that were not Veeva customers, even, getting sites and sponsors together, which is
a huge piece of it. So I think this is cheesy as fuck, but like bringing the different perspectives together across the industry, and this is a way, and we did it in North America. I don't see a reason why this wouldn't be the case here in the EU, where we can truly actually start like fostering some of those collaborations and conversations outside of your technology should talk to your technology. Let's make it happen. To be like, let's look at the bigger picture. So I'm excited to see how these conversations go.
Yeah, I'm curious, and I want to hear like from you when this is over. Like, is there a different level of engagement or relationship, I guess, between sites and sponsors at all? If the dynamic is different in any way, I'd be curious to know.
So it's interesting because I've gotten feedback. Now, this is from some of my counterparts at Veeva who work more so on the sponsor side of things. So their perspective is going to be different. Sure. But as I've had conversations, it seems like it is a different dynamic where it seems, could be a crock of shit that I'm just reading into, but it seems like there is more like collaboration and support.
Yeah.
Between the sites and the sponsors over in the EU.
That's what I wondered. And I
don't know. It seems like that's what I've heard.
Yeah.
I haven't seen it, and I mean, it could just be.
And I don't have a lot of data to support that, but that's the impression I've gotten just from the few conversations I've had and things I've seen. So I will be opening a site in Lisbon, Portugal sometime in the next year. Maybe I can actually get some good relationships going with sites.
Okay, and then you can come to Summit next year in the EU. I don't know where it's going to be, but last year it was in Madrid.
It's a big continent, so.
The big continent.
Well, very cool. That'll be fun. And then, I know you want to talk about interoperability.
Okay. So this stems out of my saga getting here. Obviously, like international travel, I was going to be like 18 hours or something. And it's just like normal, right? Like I'm flying from Madison, Wisconsin. We never have direct flights. So I'm flying somewhere, going to have a layover. Weird. Although
there's no direct flight from Madison to Copenhagen.
I think we have direct flights to like 13 cities.
Yeah.
which is also weird given that Epic is there and so many people travel out of Madison.
That's true.
But anyway, so like knew it was going to be a thing, knew there was going to be a connecting flight, knew this was going to be, to get here. And I fly Delta because, you pick your loyalty programs, and that's the one I happen to get stuck into. But you get into it, and like when they do flights, like you have like, and across how airlines work, right? Like, I mean, it's insane in general in the US, where you have United, you have American, you have Delta, but like everyone's operating on the same platform. Like things go wrong, they reroute things, like FlightAware.com connects it all, like all the data is in like the same format, everyone's talking the same language, and like you can across
there's a source somewhere that could be pulled on that everyone can use that gets the same information, sort of, is what you're getting at.
Yes,
there's an underlying like
standard platform principle, etc., where like United, Delta, American, Breeze, Frontier, not Spirit anymore, but like in general, there's an underlying like infrastructure and framework that they all use to communicate information seamlessly in real time that interacts with like the gate agents, the pilots, the consumers who are using it. And like we've come to expect that, right? Like when things are updated and there's delays and there was big storms in Atlanta, and where is my plane coming from? And like you just when all of this works, right?
Sure.
Until it doesn't. And this is what got me thinking about it, because I booked through Delta, who then had an operating partner, which was like Scandinavian Airlines. And I'm in Atlanta. I have a 5-hour layover. I get there, and then all of a sudden, like, there's different things where, like, the one app, my app is saying something. I go to talk to the Delta people at their desk, and I'm like, hey, it says F6, but there's another flight there. Then it said F3. There's another flight there. The board says F3, but then we moved to F6, and, like, my Delta app says F6, and they're like, yeah, actually, that's, like, SAS's programs, and we can't see it. That's not our stuff. And I was like, great. What does that mean then?
What do I do?
And like I booked through you. It's supposed to be on my app. And like luckily it was an interesting thing that was like sort of this like crowdsourcing of like gossip channels in the gate, because there was enough people in the same situation, and people were calling SAS. It was like 7 p.m. their time, and it was like their US office was closed, so we couldn't get a hold of them. But like there's the Delta apps, then there's FlightAware, which again, for anyone who travels, highly recommend. I think it's like they get their information like from air traffic controllers as well as like a bunch of other sources, and it generally gives you like generally good like updated information as far as like cancellations and delays. Not gates though. You know where you're supposed to be.
Right.
And like downloading like the app for the Scandinavian airline in my phone. The actual app says the scheduled time, but then the boarding pass that the app would pull up updated to the real time. So like everyone has all of these different sources and trying to piece it together. And like in theory, it's wild that we're like coordinating all of this like across the board, even to the level we were able to as like looking at FlightAware, looking at this app, doing this. But the fact that I was so grumps about it, that it wasn't how I was used to it, and like I came to expect that like it's easy for me to get this information.
Yeah.
And it was like
that's what my life looks like.
Well, right, and that's what got me thinking about this. Where I was like, in this like travel scenario as a consumer, this is what I expect, and like even the situation I had wasn't tragic. Like I could get most of the information I needed.
You'd figure it out, yeah.
But then I'm thinking about like we are the bad example of this. Like we are so far from whatever the airlines did in the 70s, at least domestically, to make this work. And like how it was within Delta, it worked. But then when this other airline worked, it didn't, or it broke, or they could get this information. And like, it seems like, shouldn't we be able to, like they did this in the 70s and 80s, right? Like
they should. Yeah, and I don't know. I mean, obviously there's I don't, again, I'm bad with analogies and they tend to fall apart easily. But like, what exists? I guess I'd be curious. Maybe we need to look it up. We can talk about it, like do some research about like the history. I feel like somebody did a talk about this one time. Maybe it was at ING, but we can figure out like how did they accomplish this, and is there like a an analog for the clinical trial space? Because there's air traffic controllers, right?
Yeah.
So, but
which is a federal organization. Like that's when the federal government shut down. Those are the folks who weren't getting paid.
True, but I'm saying they're at the very least, that's a place where like you could go to figure out what's going on anywhere across any airline at any airport. We don't really have like there's no body overseeing all of that in the clinical trial space.
There's no TSA.
Yeah, I mean, essentially.
But like the TSA is the organization. At some level, there's a level of agreed upon and accepted standards.
Yeah.
You know what I'm saying? Like
we don't have that,
yes,
right?
the air traffic controllers are there, but if everyone is sending them different information, different formats with different expectations on when they get the information, like if United sends them this in format ABC and they send it 15-minute increments, and American sends 10 times more information every half an hour, you know what I'm saying? Like there's universal rules and regulations that dictate what they need to share when and how, right?
Yeah, which is weird because I mean we are ostensibly highly regulated industry, but not when it comes to that, not like standardization across those things, so that literally anything of value could be derived from it, because right now you've just got a bunch of competing companies who aren't really cooperating in any meaningful way that might actually be good for not just them but for everybody,
right? And it's the thing that's funny though is like what needs to be regulated is regulated as far as like, and again, this is where at some level I do kind of understand the real-time clinical trials idea, where it's like we need to like act on the data and regulate the data sooner rather than waiting till we get a big packet at the end and then we regulate it. You know what I'm saying? Like it needs to like we need to regulate how it's being transmitted. You know what I'm saying? Like there's an element of more real-time regulation and monitoring that makes sense to me, as opposed to just being like, we did 6-7 years of work, here you go, and then that's super regulated and has to look all like all these things. Like if we did this at some point in this process, it makes sense. Now, I'm not saying I'm behind what was proposed, because I don't think that actually addresses it. But it's that concept of like how data is exchanged. How is your clinical data that is going to drive the FDA approvals?
Well, and this is where, and so shout out Steve Wimmer. Planes broadcast data over public radio signals. FlightAware has loads of volunteers with receivers who ping and push the info to a central repository, which there's no like that can't be done. I mean, no one is going to be broadcasting their stuff out of these private sponsors and companies and
or even
dashboards and platforms.
Who are like radioing in and like eavesdropping on people. The medical information is going to be locked down. Radio that stuff in, even if they're
I mean, I just wonder, is there a world of like at least some minimal level of cooperation that would make things consider? I mean, it may not even have to be much to actually create something considerably better. And look, wouldn't that be good for, I mean, look, we all share, these companies all share airspace, right? There's only so much space there is at an airport and in the freaking sky, for that matter. I mean, we all care about public health. Again, presumably we all care about public health in a way that wouldn't it make sense to like share some of this stuff? There's still going to be enough profits for everybody. There's enough money.
And I also think too, like doing something like this, it does add efficiencies. And again, it gets down to this, like, is it immediately giving me more money? Maybe not. But in a couple of years, if we are able to standardize, drive efficiencies, accelerate clinical trials, and like, yes, it is a long game. One
Yeah.
marshmallow now, 5 marshmallows later.
Yeah, we don't seem to like to think that way, though.
Which is wild, because you can do this experiment with kids, and at a certain age, they will understand that if I don't eat this marshmallow, I get more marshmallows.
Yeah,
And
but we want them all now and all of them later, and we want to.
I'm just gonna steal your marshmallows.
If you want them, then you have to pay. You have to pay the price to have any of my marshmallows. So we're marshmallow hoarders, you know.
Or something. So yeah,
but that's why too. I do wonder too. Like, and then maybe this is stuff you can pick up on, because obviously Europe has a very different healthcare environment. Does that change the dynamic? Does it maybe breed more cooperation because there's less like competition for like pricing and things like this? Where in the US, it's like apparently you can just charge whatever you want, for whatever you want. And I think it's a little different. It's a little different in some of these companies where it's a little more highly regulated.
So I would say my guess, so feel for folks to correct me if I'm wrong here, but my guess is like financially it is more accessible, but I know that there's a lot more like restrictive data laws in the EU.
Yeah, that's true.
And so I don't know how that balances, but like, and I don't want to say like meaningful use, because that's the big thing that drove EHR adoption, and like
which has worked out amazingly well for EHRs.
Well, but then you're looking at meaningful use was put under our healthcare system. We don't want to go down this, but like our healthcare system is a financially based system. We're a care delivery, but it's all the underpinnings of a lot of it are financially based, like insurance, billing,
money. Yeah.
Claims, all of it. But what it did do was required information to be shared in a standardized, consistent way, and certain things had to be accessible and shared in specific ways. So if I'm seen at a hospital with Epic and I go down the street and I go see a hospital at Oracle Cerner and I request my medical records, they have to share it organization-wide, but also the system they're using has to have a way to share specific elements in a specific way that makes that happen.
Sure.
And right now we don't have that. Like if you have an eSource and you're using Creo eSource and Veeva EDC, or Veeva eSource and Rave EDC, like there is nothing dictating how that needs to be shared.
Yeah.
Right? Or if and when and what are those parameters? And that is where I think we need to.
Do you think though that would, I mean, obviously I think there was probably great value in doing that from the broader healthcare system because of all the money involved in the healthcare system. We've seen some examples of clinical research being sort of maybe, not enough retail pharmacies realize it's not quite enough money in it. Maybe it doesn't move the needle quite as much. Does that make it less likely that there could be some sort of larger legislation around it, possibly? And even then, do drug companies actually want that? And would they in fact lobby against something like that because of IP, proprietary information, blah blah blah?
But it's all, we're not saying they have to share, like, and again, it's less so saying that like,
you don't need to share your IP.
It's not the data.
Yeah, that's fair.
It's
that's
the
fair.
way you transmit it. Yeah. And I would imagine that they would like that because that allows them to more easily work with sites regardless of the technology platforms that they themselves are using, because we know sponsors aren't consistent across themselves. They use a myriad of different solutions, even to manage their own internal work. So it's not even just site to sponsor communication, right? Like you'd want everything to have a standardized operating model, right?
Yeah, but then is it more just incumbent on a company the company who does it and cracks it is going to be the winner?
Yeah, but I mean, in what world have we ever seen a company take over any market segment to that level? Like even Epic does not. You know what I'm saying?
I would argue that that's about as close as you get, though, right? I mean,
the big caveat I'll put here, though, I mean, yes, it's as close as you get, but like, and yes, Epic is global, but ostensibly their platform is fairly US centric, right?
Sure.
Like they're deployed in different places, but like because our healthcare systems are so different than others, right? Whereas research, I think, tends to be a little bit more global.
Sure.
Than sort of like American healthcare and insurance and PBMs and all that shit.
All we care about is America, though. America first,
No.
America only.
Sitting here in Denmark, I don't think that's accurate.
Okay. Well, maybe don't. Maybe tell everyone you're Canadian.
I have to say that is something. It is an odd time to be traveling as an American.
Yeah. Good luck with that.
We are not the.
I
haven't had any flack.
Did you bring your "Make America Great Again" hat so that
my whole collection of
them? You can show everybody.
Yeah,
no, I mean, fair. That's fair. Yeah, I don't know. I mean, again, I still don't know the answer. I mean, it does occur to me that from a consumer, I mean, your description of airline, we would not accept that on a consumer level with anything really.
And I said, even the Delta to SAS thing, I get some information but I was able to piece it together.
Yeah, you were able to figure it out.
I was pissed about it.
And right.
And that wasn't even in the grand scheme of things.
It sounds like there were other people who were way more pissed, who are maybe less technologically savvy or more easily confused, or whatever the case may be.
That is my caveat. I will say my PSA for today is just be nice to the people at the airport. I don't understand when passengers are assholes to Delta gate agents or anyone. They are not doing any of this. They are trying their best. Being a dick about it is not going to help. Just be nice. Be nice to your airline.
Are you sure? It might be worth a try though.
Maybe they'll change the weather.
You yell at them. Maybe
you
yell at them
enough. They'll make that plane appear for you.
They're holding out. There's an extra seat in there. They just don't want to give you unless you are a little rude to them. Threaten to talk to their manager.
Must be it. And in general, most people were fine. But yeah, there were some folks who were in the airport. Brings out all kinds of folks.
Well, very good. Well, we look forward next week to hearing how it all went.
And we'll hear about SOS Regional Meetup.
Yep, Regional Meetup is Saturday at SOS. So hit me up if you need a link to register. It's free. They're always a good time. It's always a lot of good networking, and I think it's a nice little more intimate environment, which is nice. You can actually talk to people without having 400 booths that you're trying to avoid people yelling stuff at you. So yeah, hit me up if you want some info on that. Otherwise, we will not be here Thursday. Maybe I'll do a surprise. I'll do a surprise solo show on Thursday. We'll see. Otherwise, anything else before we sign off?
No, I mean, I do want to make a plug. Maybe Steve Wimmer is starting a nice MLM for a fractional marshmallow membership club. So
yeah, I think Steve Wimmer would be a good MLM
for fractional marshmallow.
I mean, there are worse ideas.
Is that mini marshmallows?
No, it's a whole one, but you have to cut it into quarters. It's very different.
Sorry, not familiar.
Wow, you'll learn. Steve will teach us.
Steve will teach us. We'll have him on. We'll talk about his fractional marshmallow model.
All right. Well, rock and roll, and we will see you guys next.
Catch you next week.
Tuesday. Have fun in Denmark.
Have fun in Raleigh.
Later. Thanks for listening to Note to File. We're committed to continuing to bring you independent and unfiltered coverage of the clinical trial industry.
We want to talk about what you want to hear. So if you have something on your mind, hit us up at notetofilepodcast.com.